Question 1. A nurse finds a client with a chest tube disconnected from the drainage system. What is the priority action? A. Clamp the chest tube. B. Reconnect to the drainage system. C. Submerge the end in sterile water. D. Notify the healthcare provider. Answer. C. Submerge the end in sterile water. Question 2. A client receiving vancomycin develops flushing and hypotension. What is the most likely cause? A. Allergic reaction. B. Sepsis. C. Red man syndrome. D. Fluid overload. Answer. C. Red man syndrome. Question 3. Which client requires immediate assessment? A. A client with a pulse of 98 BPM. B. A client reporting sharp chest pain and dyspnea. C. A client complaining of constipation. D. A client requesting discharge instructions. Answer. B. A client reporting sharp chest pain and dyspnea. Question 4. A nurse notes absent bowel sounds after abdominal surgery. What is the priority action? A. Administer a laxative. B. Notify the provider. C. Document the finding. D. Encourage oral fluids. Answer. C. Document the finding. Question 5. A client with a history of opioid use has pinpoint pupils and low respiratory rate. What should the nurse do first? A. Call a code. B. Administer naloxone. C. Increase oxygen. D. Start chest compressions. Answer. B. Administer naloxone. Question 6. A client newly diagnosed with tuberculosis is being discharged. Which statement indicates need for further teaching? A. I will wear a mask in crowded places. B. I can stop taking my meds when I feel better. C. I need to take my medication for several months. D. I'll cover my mouth when I cough. Answer. B. I can stop taking my meds when I feel better. Question 7. A client with heart failure gains 3 pounds overnight. What is the nurse's priority action? A. Encourage ambulation. B. Restrict fluid intake. C. Notify the provider. D. Reassess in 24 hours. Answer. C. Notify the provider. Question 8. What is the most appropriate method to verify placement of a nasogastric tube? A. Auscultate over the stomach. B. Aspirate gastric contents. C. Check for bubbling in water. D. Rely on client's report. Answer. B. Aspirate gastric contents. Question 9. A client receiving 4 potassium reports burning at the site. What should the nurse do first? A. Stop the infusion immediately. B. Apply ice to the site. C. Dilute the potassium further. D. Slow the infusion rate. Answer. D. Slow the infusion rate. Question 10. A nurse is preparing to administer eye drops. Which action is correct? A. Instill drops directly on the cornea. B. Pull the upper lid upward. C. Pull the lower lid down and instill into conjunctival sac. D. Apply drops before cleaning the eye. Answer. C. Pull the lower lid down and instill into conjunctival sac. Question 11. A nurse is caring for a client with a serum sodium level of 127 milliequivalent/L. Which symptom is most concerning? A. Muscle cramps. B. Abdominal bloating. C. Confusion. D. Dry mucous membranes. Answer. C. Confusion. Question 12. Which task is appropriate to delegate to a licensed practical nurse, LPN? A. Initial assessment of a new admission. B. Triage of an emergency room client. C. Administering 4 morphine push. D. Monitoring a stable client post-op. Answer. D. Monitoring a stable client post-op. Question 13. A nurse is preparing a client for an MRI. Which finding requires immediate attention? A. Allergy to shellfish. B. Tattoo from 10 years ago. C. Implanted pacemaker. D. Claustrophobia. Answer: C. Implanted pacemaker. Question 14. A client with rheumatoid arthritis is prescribed methotrexate. Which instruction is most important? A. Take with grapefruit juice. B. Report signs of infection immediately. C. Stop taking if you feel tired. D. Increase intake of dairy products. Answer: B. Report signs of infection immediately. Question 15. A client with chronic kidney disease has a new prescription for epoetin alpha. What lab value should be monitored? A. WBC count. B. Hemoglobin. C. Platelets. D. Potassium. Answer: B. Hemoglobin. Question 16. A nurse is reviewing lab values. Which value is critical and should be reported immediately? A. Potassium 5.0 milliequivalent/L. B. Hematocrit 45%. C. 4.8 Indian rupees. D. Sodium 138 milliequivalent/L. Answer: C. 4.8 Indian rupees. Question 17. A nurse is educating a client on insulin glargine. Which statement indicates correct understanding? A. I will mix it with regular insulin. B. I will take it right before meals. C. I will not mix it with other insulins. D. I can take it twice daily if needed. Answer: C. I will not mix it with other insulins. Question 18. Which situation best requires the nurse to use SBR communication? A. Charting client intake. B. Handoff report during shift change. C. Discussing menu choices with the client. D. Reporting abnormal findings to the provider. Answer: D. Reporting abnormal findings to the provider. Question 19. A client reports severe pain after a tonsillectomy. Which action is most appropriate? A. Offer ice chips. B. Provide warm fluids. C. Administer prescribed analgesic. D. Instruct the client to gargle with salt water. Answer: C. Administer prescribed analgesic. Question 20. A client in labor is receiving oxytocin. The fetal heart rate shows late decelerations. What should the nurse do first? A. Turn the client to her left side. B. Increase the oxytocin rate. C. Administer methylergonavine. D. Document and continue monitoring. Answer: A. Turn the client to her left side. Question 21. What is the priority action when a client with AC difficile infection has diarrhea? A. Provide a high-fiber diet. B. Apply a barrier cream. C. Place on contact precautions. D. Encourage fluid restriction. Answer: C. Place on contact precautions. Question 22. A nurse is teaching about isoniazid INH for tuberculosis. Which client statement indicates understanding? A. I should avoid alcohol while taking this medication. B. This drug may cause orange urine. C. I can stop taking it after 3 weeks. D. I should limit my intake of green leafy vegetables. Answer: A. I should avoid alcohol while taking this medication. Question 23. A nurse is reviewing the plan of care for a client with impaired swallowing. What is the best intervention? A. Offer thin liquids with meals. B. Place client in supine position when eating. C. Keep suction at the bedside. D. Avoid oral hygiene. Answer: C. Keep suction at the bedside. Question 24. What is a key discharge instruction for a client prescribed furosemide? A. Report muscle cramps or weakness. B. Limit potassium intake. C. Take medication at bedtime. D. Avoid all sun exposure. Answer: A. Report muscle cramps or weakness. Question 25. A client is being discharged with a new prescription for warfarin. What is the most important instruction? A. Use a firm bristle toothbrush. B. Monitor for signs of bleeding. C. Eat more leafy greens. D. Take NSAIDs as needed. Answer: B. Monitor for signs of bleeding. Question 26. A client has a potassium level of 2.9 milliequivalent/L. Which clinical manifestation is expected? A. Muscle weakness. B. Hypertension. C. Bounding pulses. D. Slow capillary refill. Answer: A. Muscle weakness. Question 27. Which task should the RN delegate to an unlicensed assistive personnel UAP? A. Perform sterile wound dressing. B. Educate the client on insulin use. C. Feed a stable client with dementia. D. Administer a tube feeding. Answer: C. Feed a stable client with dementia. Question 28. A client with liver cirrhosis has ascites. What is the most appropriate nursing intervention? A. Encourage fluid intake. B. Monitor abdominal girth. C. Elevate the legs. D. Limit sodium intake to 4g/day. Answer: B. Monitor abdominal girth. Question 29. A client with a PEG tube develops a fever and foul-smelling drainage around the site. What should the nurse do first? A. Flush the tube. B. Apply barrier cream. C. Notify the healthcare provider. D. Elevate the head of the bed. Answer: C. Notify the healthcare provider. Question 30. A nurse is educating a client about a new diagnosis of type 2 diabetes. Which statement needs correction? A. I'll check my blood sugar regularly. B. I can skip meals to lose weight. C. I'll inspect my feet daily. D. I'll attend a diabetes education class. Answer: B. I can skip meals to lose weight. Question 31. A nurse is caring for a client with an NG tube to suction. The client reports nausea. What is the priority action? A. Irrigate the tube. B. Assess tube placement and patency. C. Administer an antiemetic. D. Clamp the tube temporarily. Answer: B. Assess tube placement and patency. Question 32. What is the appropriate action when a nurse finds a client having a tonic-clonic seizure? A. Insert a tongue blade. B. Restrain the client. C. Turn the client on their side. D. Hold the client's arms. Answer: C. Turn the client on their side. Question 33. A nurse is caring for a post-op client with a urinary catheter. Which finding requires immediate action? A. Dark yellow urine. B. Urine output of 20 milliliters per hour. C. Small blood clots in tubing. D. Client reports mild discomfort. Answer: B. Urine output of 20 milliliters per hour. Question 34. A nurse is assessing a client with COPD. Which finding is expected? A. Respiratory rate of 10 per minute. B. Clubbing of fingers. C. Bradycardia. D. Cold, clammy skin. Answer: B. Clubbing of fingers. Question 35. A client receiving TPN suddenly develops chest pain and shortness of breath. What is the nurse's priority? A. Administer analgesics. B. Slow the infusion rate. C. Clamp the catheter and position on left side. D. Recheck the blood glucose. Answer: C. Clamp the catheter and position on left side. Question 36. A client has a new prescription for lisinopril. Which side effect is most concerning? A. Dry cough. B. Hypotension. C. Angioedema. D. Nausea. Answer: C. Angioedema. Question 37. Which lab value should be monitored closely with furosemide therapy? A. Sodium. B. Creatinine. C. Potassium. D. Hemoglobin. Answer, C. Potassium. Question 38. A nurse receives 4 calls. Which client should the nurse call back first? A. A client with chronic back pain requesting refills. B. A client reporting chest pressure after taking nitroglycerin. C. A client with constipation after surgery. D. A client asking about lab results. Answer, B. A client reporting chest pressure after taking nitroglycerin. Question 39. Which of the following is a priority action after administering a new antibiotic? A. Monitor blood glucose. B. Assess bowel sounds. C. Observe for signs of allergic reaction. D. Encourage fluid intake. Answer, C. Observe for signs of allergic reaction. Question 40. A nurse is educating a client about preventing urinary tract infections. Which statement shows understanding? A. I'll wipe from back to front. B. I'll urinate after intercourse. C. I'll hold my urine if I'm busy. D. I'll take daily bubble baths. Answer, B. I'll urinate after intercourse. Question 41. A client with asthma is prescribed albuterol. Which statement indicates a need for more teaching? A. I'll use this during an asthma attack. B. I'll use this before exercising. C. I'll use this daily even when I feel fine. D. I may feel shaky after using it. Answer, C. I'll use this daily even when I feel fine. Question 42. A client receiving 4 fluids develops crackles in both lungs. What is the priority action? A. Stop the 4 fluid. B. Call the provider. C. Reassess in 1 hour. D. Document the findings. Answer, A. Stop the 4 fluid. Question 43. A nurse is reviewing safety precautions with a client on seizure precautions. What should be at the bedside? A. Tongue depressor. B. Restraints. C. Oxygen and suction equipment. D. Portable defibrillator. Answer, C. Oxygen and suction equipment. Question 44. A nurse is caring for a client receiving a transfusion. Which symptom suggests a hemolytic reaction? A. Fever and chills. B. Urticaria and itching. C. Back pain and dark urine. D. Bradycardia and hypotension. Answer, C. Back pain and dark urine. Question 45. A client with suspected appendicitis reports relief of pain. What should the nurse do first? A. Document the finding. B. Reassess in 15 minutes. C. Notify the healthcare provider. D. Encourage ambulation. Answer, C. Notify the healthcare provider. Question 46. What is the appropriate action if a nurse drops sterile forceps on the floor? A. Rinse and reuse them. B. Ask another nurse to retrieve them. C. Replace with new sterile forceps. D. Use gloved hands to pick up items. Answer, C. Replace with new sterile forceps. Question 47. A client newly diagnosed with hypertension asks about lifestyle changes. What is the nurse's best response? A. You should avoid all dairy. B. Eat more canned foods for potassium. C. Reduce sodium and engage in regular exercise. D. Increase red meat intake. Answer, C. Reduce sodium and engage in regular exercise. Question 48. A nurse is assessing a client post-thyroidectomy. Which finding requires immediate intervention? A. Hoarseness. B. Neck discomfort. C. Difficulty speaking. D. Stridor. Answer, D. Stridor. Question 49. Which statement indicates proper understanding of wound care by the client? A. I will clean the wound with alcohol daily. B. I will remove the scab to allow healing. C. I will wash my hands before changing the dressing. D. I can reuse dressings if they look clean. Answer, C. I will wash my hands before changing the dressing. Question 50. A nurse is reviewing medication for a client taking digoxin. Which symptom suggests toxicity? A. Increased appetite. B. Blurred vision and nausea. C. Diarrhea and anxiety. D. Headache and dry mouth. Answer, B. Blurred vision and nausea. Question 51. Which client should the nurse see first during morning rounds? A. A client with BP 148/92 mmHg requesting water. B. A client who reports new shortness of breath. C. A client scheduled for discharge in 2 hours. D. A client asking for assistance to the bathroom. Answer, B. A client who reports new shortness of breath. Question 52. A nurse is caring for a client with suspected meningitis. Which intervention is priority? A. Place the client in a private room with droplet precautions. B. Elevate the head of the bed to 90 degrees. C. Encourage oral fluids. D. Prepare for lumbar puncture. Answer, A. Place the client in a private room with droplet precautions. Question 53. Which client condition places them at highest risk for aspiration pneumonia? A. Parkinson's disease with dysphagia. B. Asthma with wheezing. C. Diabetes with hyperglycemia. D. Anemia with low hemoglobin. Answer, A. Parkinson's disease with dysphagia. Question 54. What is the nurse's priority for a client in the postictal phase after a seizure? A. Check for injuries. B. Reorient the client. C. Offer food and fluids. D. Restrain the client. Answer, A. Check for injuries. Question 55. A nurse is preparing to administer a subcutaneous heparin injection. What is the correct technique? A. Aspirate before injecting. B. Massage the site afterward. C. Use a 90-degree angle and do not aspirate. D. Use the deltoid muscle. Answer, C. Use a 90-degree angle and do not aspirate. Question 56. What is the best way to prevent catheter-associated urinary tract infections, CAUTIs? A. Encourage increased oral fluid intake. B. Perform catheter care every shift. C. Limit catheter use and remove as soon as possible. D. Irrigate the catheter daily. Answer, C. Limit catheter use and remove as soon as possible. Question 57. A client is receiving oxygen at 2 liters per minute via nasal cannula. What is the appropriate nursing action? A. Apply oil-based moisturizer around the nostrils. B. Ensure the oxygen is humidified. C. Increase flow to 6 liters per minute during meals. D. Switch to face mask for better delivery. Answer, B. Ensure the oxygen is humidified. Question 58. What is a priority action after administering lorazepam 4 to a client with acute anxiety? A. Provide clear oral fluids. B. Monitor respiratory status. C. Assess for urinary retention. D. Evaluate bowel sounds. Answer, B. Monitor respiratory status. Question 59. What is the most accurate method for verifying nasogastric tube placement? A. Ask client to talk. B. Inject air and auscultate. C. X-ray confirmation. D. Check for bubbling in water. Answer, C. X-ray confirmation. Question 60. A nurse is caring for a client with an elevated INR of 5.0 on warfarin. What is the priority action? A. Administer protamine sulfate. B. Give vitamin K as prescribed. C. Hold the warfarin dose. D. Prepare for dialysis. Answer, B. Give vitamin K as prescribed. Question 61. A nurse is caring for a client receiving total parenteral nutrition, TPN. What requires immediate attention? A. Weight gain of 1 pound in 2 days. B. Blood glucose of 260 milligrams per deciliter. C. TPN solution appears cloudy. D. Client reports mild hunger. Answer: C. TPN solution appears cloudy. Question 62. A nurse enters a client's room and finds the client on the floor. What should the nurse do first? A. Notify the provider. B. Document the fall. C. Assess for injury. D. Call the family. Answer: C. Assess for injury. Question 63. A nurse is educating a client with heart failure about daily weight monitoring. Which statement is correct? A. I will weigh myself after meals. B. I should weigh myself at night. C. I will weigh myself daily at the same time. D. I will weigh only if I feel swollen. Answer: C. I will weigh myself daily at the same time. Question 64. A client has a new order for a soft wrist restraint. What is the nurse's priority? A. Tie the restraint tightly to ensure safety. B. Place the restraint on the bed rails. C. Pad the skin under the restraint. D. Remove the restraint every 8 hours. Answer: C. Pad the skin under the restraint. Question 65. A client with Clostridioides difficile is placed on precautions. Which infection control action is correct? A. Use alcohol-based hand rub before entering. B. Wear surgical mask and gloves. C. Perform hand hygiene with soap and water. D. Use airborne precautions. Answer: C. Perform hand hygiene with soap and water. Question 66. A nurse is preparing to administer a blood transfusion. Which action is most important? A. Use 22 gauge for catheter. B. Verify client identity with another nurse. C. Warm the blood before administering. D. Start infusion at 200 milliliters per hour. Answer: B. Verify client identity with another nurse. Question 67. A client is on 4-furosemide. Which assessment is a priority? A. Bowel sounds. B. Lung sounds. C. Reflexes. D. Peripheral pulses. Answer: B. Lung sounds. Question 68. A nurse is caring for a client with a new colostomy. Which action promotes client independence? A. Change the appliance for the client. B. Have the client observe each step during a change. C. Perform stomacare without involving the client. D. Delay teaching until discharge day. Answer: B. Have the client observe each step during a change. Question 69. A nurse receives change of shift report. Which client should be seen first? A. A client with controlled type 2 diabetes. B. A client post-op day 1 with no pain. C. A client reporting chest tightness and dizziness. D. A client with BP of 138/86 mmHg. Answer: C. A client reporting chest tightness and dizziness. Question 70. Which behavior indicates effective time management for a busy nurse? A. Prioritizing charting before assessments. B. Multitasking all responsibilities simultaneously. C. Completing one complex task before checking clients. D. Planning care based on client acuity and needs. Answer: D. Planning care based on client acuity and needs. Question 71. Which action helps prevent medication errors during medication reconciliation? A. Ask the pharmacist to perform the reconciliation. B. Use generic names only. C. Compare the current prescription with home medications. D. Discontinue all previous medications automatically. Answer: C. Compare the current prescription with home medications. Question 72. A nurse finds an unlabeled syringe in the client's room. What is the correct action? A. Use the syringe if the medication is known. B. Return it to the medication room. C. Discard it safely per hospital protocol. D. Ask the client what it was for. Answer: C. Discard it safely per hospital protocol. Question 73. A client is prescribed digoxin. Which finding requires immediate intervention? A. Heart rate of 58 BPM. B. Blurred vision. C. Regular apical pulse. D. Nausea after meals. Answer: A. Heart rate of 58 BPM. Question 74. A nurse is planning care for a client in skeletal traction. Which intervention is appropriate? A. Keep weights resting on the floor. B. Remove weights during bathing. C. Maintain weights freely hanging. D. Elevate the traction bar. Answer: C. Maintain weights freely hanging. Question 75. A client receiving opioid analgesics becomes unresponsive with shallow breathing. What is the priority action? A. Administer naloxone. B. Apply a warm compress. C. Elevate the head of the bed. D. Start 4 fluids. Answer: A. Administer naloxone. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.